May you be free from all inner and outer harm and danger. May you be safe. May you be happy. I'm Nuan Fonseca, the founder of Integrative Mindfulness Center. Thank you for joining with this video. This video, we are going to talk about a very important recommendation that recently done by World Health Organization. It's called the Mental Health and Psychosocial Consideration during the COVID-19 outbreak. Uh, it is a very simple document that have been produced by World Health Organization for general public uh, and population to maintain their psychological well-being during this outbreak period. Um, as you know, uh, we all been struggling with the COVID-19 coronavirus outbreak. It's a difficult time for all of us. We all struggling not only physically, not only socially isolating, and also psychologically. We all struggling. Not only health professionals and frontline workers, all the human population is struggling all over the world. Um, the virus treating everyone differently and difficultly without without any category, rich, poor, educated, non-educated. Uh, it's treating very differently. Um, World Health Organization around the world, the organization is supposed to the organization provide support to general public. Um, so the consideration, these 30 recommendations presented in the document, it had been developed the World Health Organization Department of Mental Health and Substance Use. They done many research and many studies based on cultural, diverse, multicultural factors and functions, and they came out with this 30 amount of recommendation. So for the next 15 to 30 minutes, I would like to brief talk about these things. You could always go back to World Health Organization website and find the actual document. It's all there. Even if you like reading, it's all information included with many explanation. All the documents are free. But I would like to start from number one recommendation. The number one recommendation is very simple recommendation. It's all about being empathic to all people affected by this COVID-19. So many people affected in many countries. Maybe your geographical area, maybe around your home, maybe around your social settings. You're referring to people, with the COVID-19 title, the organization asking not to refer it because it is a very unhealthy psychological naming. Do not attach the disease to any particular ethnicity or nationality or family, household, village, city. For example, COVID-19 family or COVID home, COVID country, um, uh, Wuhan virus. So they're recommending not to do that. Number two is also a very simple request. Do not refer to people with the COVID-19 cases because there's many victims already labeling, having this point. Victim families, victim individuals, victim countries, victim villages, victim societies, victim groups. So now you see many victims are slowly coming out this point. And people who've been treated COVID-19, who already recovered COVID-19 or recovering from COVID-19, after recovering from COVID-19, their life will go on with their relationships, social life, jobs, family, and loved ones. So having that labeling, having that disease labeling, that uh, probably insult and make their life harder and difficult. So number three is a very important thing. Number three recommendations, and I know everywhere you go, every social media you expose, you see many Facebooking, TV programs, many individual discussions about COVID-19. Some reading and listenings are not really healthy, which increase your level of anxiety, your fear, your distresses, and even many situations like depression or other psychological challenges. So make sure you're choosing the right information with the right people, right time, right information, right people, or right organization, right time. Right time is very important you to find, because you're not ready all the time to expose to many informations. Sometimes you're exposing to information without readiness, probably increase your fear, anxiety, and many other psychological challenges. So gather information, a list of information in WHO website. Always refer yourself to WHO, and you see a lot of helpful informations. Number four recommendation for mental health is you have to protect yourself. Basically, you have to have idea who yourself, what you belongs to. That helps you to protect yourself, um, and assessing to other people their time, needs, and benefit. Receiving support and help, you need to really be mindful. For example, check with other people over the telephone, social media, Facebooking, um, Viber, WhatsApp, Imo, or any other social media. This is the good time you to connect with the people that you don't have relationship for last while. Um, um, and minimize communication and contact in person. Number five, this is a good chance to find opportunities to amplify positive and helpful self-images, stories. We all live in with positive images, history, a lot of past happy experience. So if you live with your family, this is a wonderful time to share what you brought from your childhood and what you didn't discuss with your family for longer, with that recommended distance, 1 meter or 1.5 meter. Um, for example, the stories behind you. My working population is native population, First Nations, and Aboriginal populations. They have lots of family stories. They bring lots of historical stories. This is a wonderful time they to practice their narrative historical histories and culture in between family members that has been damaged and neglected long termly, and even the diversity, a multicultural population. This is a wonderful time they allow them to share their images and stories. Number six is about healthcare workers. We all considering them as frontline honor carrier healthcare workers. We need to support them. We need to make sure they're doing fine. Check your friend healthcare worker family, or call your friend healthcare worker and see how he's or she's doing, how the family is doing. Do they have enough food? Do they have enough support, or they do have enough things? So this is a wonderful time to check them. Number seven recommendation. Um, all we live with the under pressure at this point. Likely experience many of us, our colleagues, our friends, people working with us. It's quite a bit of normal feeling this way, fear, anxiety, uncertainty. Um, Many stresses are associated with reflections that we cannot proceed our performance and jobs. You feel you might be weak. So it's important you to manage your psychological health and psychosocial well-being. If you want to go to website and a little bit Google and study about what psychological well-being and psychosocial support, there's a plenty of resources in World Health Organization and other recommendation websites. So number eight is This is a good time you to take care of yourself. My experience with many time, people always complain about not having time, not having enough time. Spend time with yourself, understand yourself, read yourself, learn about yourself that you were missing for last decades. Find when you start studying yourself, learning about yourself, you start feeling coping mechanisms and strategies, such as hobbies. You start finding many healthy food, physical activities, and necessary things, because you're already finding yourself. It's a good resource time you to spend yourself and find yourself. More you find yourself, you will develop your own coping strategies, and easily you could avoid drug abuse, substance abuse, and a lot of dysfunctional coping mechanisms. Uh, you mostly go back to those mechanisms, those steps, those strategies, if you don't really know yourself, if you don't really find what you improve yourself. So I would like to go with number 9, and I had a little bit speak fastly because it's a lot of numbers here. I know when we have many numbers, you don't like to watch the video. So number 9 is, as we know, a lot of healthcare professionals already experiencing, unfortunately, avoidance by their friends, family members, their loved ones. Already it's discomforting, it is uncertainty and fear. It's very normal, but what happening badly is, when the healthcare providers are experiencing individually this experience, they might lose their energy and strength, and skill of dealing with the difficult situation. So it's important to maintain, help their mental state, stay connect with your loved ones. The digital medias are very strong right now, so join with the digital medias. Ask your colleagues and your manager or any trust person for social support, or maybe find a colleague may experience in this, or find someone that you can trust. Number 10 is, it's also very important, using understandable way to sharing and talking your messages with people intellectuality. People have different level of intellectuality. The cognitive ability is very different. Some people living with psychosocial disability, some people living with communication issues. Find easy understandable way to reach them, instead of using the same language. Especially this is important, social media, the newsfeed media and TV services and government public TV services. I see they're using some support transmission services for deaf and blind and many disability people. If you have someone living with you around you, make sure that they are understanding certain thing or helping them to connect with the right resources. I would like to go with number 11. As we all know, how to provide support to people who are affected by COVID-19, the link and resources, there's many resources. Share with your resources people that you don't have their resources, or the psychosocial support, people who really need psychosocial support. There's many stigma you see associated with COVID-19. Stigma fighting is very dangerous. It builds you totally different scenarios and mental state. Make sure people dealing with their stigma properly. The best recommendation is, you could see in my video, the recommendations are on below of the video. By clicking and by subscribing and activating the bell icon, you could get all this information. There's information pamphlet called MHGAP, Humanitarian Intervention Guidebook. It's free in WHO website, so have it, read it. You will get a lot of information from there. So number 12 is, keeping all staff and people working with you, people belongs to your supervision, keeping all staff protected, help them to be protected by giving them the knowledge and actual acknowledgement, and make sure they're not involving with poor mental health activities. I mean, you might think why we are worried about it. It's a professional responsibility. Yes, it is. But unfortunately, this time of the world, professionals are very busy concentrating and focusing the high risk population. They might lose tracking the general population living in home by isolating themselves or curfews or many other way. Number 13, ensure the good quality communication, accurate informations, high stress, low and stress functions, and these kind of things. Make sure we've been using this buddy technique system. All you know what mean by buddy technique. Finding the buddy, connecting with the buddy, using the buddy techniques to share help, workload, responsibility load, carrying the heavy workload from your buddy so that your buddy would be more flexible and more stable. World Health Organization recommending buddy technique. They think buddy techniques is the best way to support providers, monitor the stress your friend, and reinforce safety, support, and procedures, and also ensure that their personal well-being and things are fine. Number 14, it's all about people and staff working with you around you. Make sure the psychosocial health and support services are facilitating, guide them to right services. And I'm sure you're all aware of hotline numbers, support line. There's many of those lines right now. The informations are everywhere. Some informations are regionally some information are nationally provided. So have this information and make sure if you're a manager, if you're a leader, to be a role model for self-care strategies to manage the stress to your employees and people around you. Number 15, the high risk frontline population, nurses, ambulance driver, volunteers in health services, nursing facilities, nursing and teachers, sometimes community leaders. Make sure all you update your psychological first aid. I now also see nowadays you could update your psychological first aid by online support services. So make sure you are improving that. Make sure you are updating your psychological first aid. It is very important. Number 16, there's many mental health and neurological situations such as delirium, dementia, psychosis, depressions, and general health public services and emergencies still open to these clients and patients. So mental health and psychosocial services are increased this point with many public and private EAP services and counseling services. So let them to connect. You could always refer yourself to that humanitarian intervention guide book at download from WHO. Number 17. Again, if you have any questions, please refer yourself to WHO booklet or ask me. I would guide you to find some information according to my availability. Number 17 is people under psychotropic medications and psychological treatments. Make sure that they're involving over the webcams, over the long distance services, EAP services, and some remote access services. So it's very important them to continue their treatment plan. Most of the services are right now considering as mandated services. Number 18 in WHO mental health guideline, children is most important. A lot of children are dealing with anxiety, attachment issues, and some of them are recalling their trauma. Children need to help and find a positive way to express their emotion, feeling, such as anxiety, fear, sadness, many things. So do not stop and push children of expressing their emotions, even you are living with some difficulties, because children develop certain thing, they don't express it right away, they don't discuss it right away, they don't show you up, but long termly they will come out with some other situation, some other disease, some other, sorry, psychological conditions. Number 19, keep children close to their parents and family. Children's under foster care and under other agencies, it's important them to have contact with their parents long distantly, because when situation goes like COVID-19, children are more seeking attachment, attention, and you might see sometimes they're AWOL, sometimes you see they walking all the way around, sometimes you see they acting out. Behaviors like ADHD, ADD, you see they are expressing a lot of those behaviors and those emotions. So children really need that attention. They need to feel the safeness. Do not do any separation at this point. Try to always stay with your children and make sure they getting everything they need. That is minimize a lot of long-term issues with children. It's so important. Number 20, maintain healthy family routines. If you don't have time previously to find, discuss with your family, build up a family routine pattern, follow up a healthy family routine pattern guidelines, so that you could have some self-structural family guidelines. This is extremely important you to have during this period, and help them to learn about what the family routine and how we could include the activities and age appropriate activities for children, not letting them to play video game 24/7 like I see with my many clients. Children are becoming more addictive to video games with this lockdown period, which is very very unhealthy. Imagine a child playing video games for 15-16 hours, so he might risk in developing some situations, some conditions, right? So number 21, it's about the stress and crisis with children. Children's experience a lot of stress and crisis related thoughts. They have no word to express and talk about it. By discussing what exactly the COVID-19 with your children, by using certain tools recommended by provincial health or your agency, in an age appropriate way, very important. If your children have concern, addressing them together, maybe talk to the mental health worker or EAP counselor or helpline. There's many helpline. I see our Prime Minister introduced and many authorizations or many agencies, many EAP services introduce many helplines. So those resources probably help to manage the anxiety and acknowledgement with children. Number 22, our adult senior population is already isolated at this point because they are high risk to developing certain situations. So they might be dealing with cognitive declines, dementia, many other psychological concerns include anxiety, anger, stress, agitations, withdrawals from many outbreakings, constant fear and uncertainty. Be sensitive to all the adult and isolated population, and help them to find the professionals. Number 23, share the simple fact information about giving clear information how to reduce risk infections in to adult population. Maybe spend time with your grandma, spend time with the adult senior living next to your door, by using telephone, maybe social media, and make sure they're getting these informations, or send them attachments through emails, maybe FaceTiming attachments or Skype attachments. So there's many ways you could still do this without direct communications. Number 24, if you have underlying health conditions, make sure you access the medications. Make sure you maintain your medications well, because without you knowing, not having that proper underlying medication treatment, you see your fear, your anxiety, your stressful mind is building a lot of triggers, a lot of risk. And number 25, prepare for in advance where and how to get practical help if you need. So I know some people have hesitation to access services, so already talk to yourself, talk to your counselor, ready yourself for that future step if you need. You have to have a printed list that you can share with the people you love and care and people you know, like taxi phone numbers, food delivery services, health service providers, hotline, 24/7 support line. Like, you have to have some printed material. So I recommend you to have a collection and print and put it on your wall, or maybe your refrigerator front door maybe. Number 26, physical exercise is very important. I don't think I need to tell about it. Burning right amount of calorie. I see a lot of psychologists and health coaches, they're talking about how you could use the physical health. Like yesterday I saw someone is describing how you could do physical health by using a broomstick. When you see it, it looks like funny, but if you really mindfully watch it, you see how it's important. It's very important. It's very practical. Number 27, routine schedule, possible help, crew, finding new environment, including regular exercising, cleaning, daily activities, doing painting, drawing, making hobbies, watching positive movies, positive videos, very important. 28, stay connected with your social network as much as possible. Develop or join with a meetup group online, social network group online. There's many meetup groups online. You will find many social network group online. Some groups are in by recognized organization. Pay attention to your needs and feelings. Number 29, engage healthy activities. Enjoy relaxing, doing meditation, relaxation, anything you like. Regular sleep, maintaining regular sleep pattern is important. So now you have plenty of time to sleep well. Enjoy your sleep. More you sleep in a right time, right day, right way, more improve your health. Number 30, last one, a near constant stream news report, information reports about outbreak can cost anyone death, or information about people suffering, dying. It's all include your feeling your anxiety, fear, and distresses. So seek information updated and practical guidelines any specific time during the day with right healthcare professionals that you or the WHO website, Health Canada website. Only refer yourself to those information. So I am done talking about all these 30 things. I only concentrate improving mental health. As a mental health clinician, I have fully right to acknowledge my client and whoever in YouTube and social media to read this. So I recommend all of you to visit website WHO references and follow up those information, Health Canada informations. You have wonderful day. Stay safe. You be free from all harm, inner and outer danger. I'm wishing you loving and kindness, metta. Have a good, happy day. Thank you.